Hello and welcome to our video about the causes of bad breath from stomach. You may be experiencing a bad breath from the stomach because of some medical condition, such as GERD or IBS. But there are also other causes of stomach-related bad breath, such as constipation or dry mouth. In this video, we'll explore some of the more common causes to find the best cure for your problem. Listed below are a few of the more common causes of bad breath from the stomach. GERD. If you've ever experienced bad breath after eating, it may be due to gastroesophageal reflux disease, or GERD. This condition causes stomach acids to flow back up into the esophagus. This recurring problem can cause mouth odor, and can lead to chest pain and discomfort. It can also result in tooth decay. Fortunately, there are a number of steps you can take to prevent or cover up bad breath caused by GERD. The first step in diagnosing GERD is to get a diagnosis. Symptoms such as heartburn and acid regurgitation can help your doctor determine the correct diagnosis. If these symptoms persist after you've taken over-the-counter remedies, further testing may be necessary. A pH probe study may be needed to measure the level of acid reflux in the stomach. The monitor will determine the cause of the reflux. If the reflux level is above a certain percentage, GERD is the cause of your bad breath. A doctor can recommend a treatment plan based on your symptoms and determine the best approach to taking care of your condition. Bad breath usually goes away within a week or two, depending on the severity of the condition. If you're on medication for GERD, the doctor may recommend some changes to the dosage. Other steps to relieve bad breath from stomach due to GERD include drinking plenty of water and chewing sugar-free gum. Chewing gum stimulates the production of saliva, which helps clear acid in the mouth. Stopping smoking is also important, as smoking contributes to GERD symptoms. Changing your diet may be the best way to alleviate the symptoms of GERD and ensure a healthy future. IBS. If you have bad breath from the stomach because of IBS, there are a few things you should know about the condition. Many people with IBS also have heartburn. Heartburn is a symptom of IBS and is caused by partially digested stomach contents flowing back up the esophagus. Some people also experience waterbrash, regurgitation of clear fluid into the mouth. While this condition is unlikely to be the cause of the disease, your doctor may want to rule out any serious conditions first. Your doctor may perform a gastroscopy, which is a test that involves an examination of the esophagus. The most common symptom of IBS is a fecal odor in the mouth. It can occur during a bowel movement or after a period of fasting. IBS is a chronic ailment and the symptoms can vary from person to person. It may also cause loose bowel movements and difficult passing of stool. Some people also experience diarrhea, which causes poor digestion and nutrient malabsorption. Ultimately, this condition can lead to dry mouth and bad breath. Constipation. A common cause of bad breath from stomach and constipation is a buildup of bile in the gallbladder. Gallbladder disease can result in pain in the upper right abdomen and nausea. If left untreated, it can lead to gallbladder infection. In addition to constipation, a buildup of gallstones in the gallbladder can lead to bad breath. However, bad breath is not necessarily the result of a bile blockage. Constipation is also associated with a buildup of undigested food in the bowels. When it comes to preventing constipation, it's vital to remember that the bowels are sensitive to emotional states. For example, stress and anger can make it harder to have a good bowel movement. While a few of these feelings can be normal, many people can get constipated for no apparent reason. Dietary changes and regular exercise are often enough to prevent constipation. While most cases of constipation can be treated at home, if it persists or is accompanied by bleeding or other symptoms, it may be time to see a doctor. If you are prone to constipation and indigestion, it may be time to consult a physician. Intestinal obstructions, whether in the large or small intestine, can lead to bad breath. Food stuck inside an obstruction can ferment and cause bad breath. Your doctor will be able to diagnose and treat this condition. There are several treatments available for constipation and indigestion, and you can also seek natural remedies to treat your condition. Dry mouth. Dry mouth after bad breath from stomach is often accompanied by a toasty or acidic odor. It can also feel as if there is very little saliva in the mouth, and the odor can aggravate ulcers or canker sores. If you experience bad breath after stomach emptying, there are several things you can do to get rid of it. One way to get rid of it is by practicing good oral hygiene. You can treat your bad breath by chewing sugarless gum and gargling water immediately after eating. Besides that, you can also visit your dentist regularly, and make sure to clean your dentures thoroughly at night. Using artificial saliva substitutes can help you avoid these dietary changes, and you can also eat foods that are notorious for adding to bad breath. Avoid foods that contribute to bad breath, such as garlic, onions, and fish. If your breath still remains, you can use mouthwash to clear it. Some autoimmune conditions can also cause dry mouth, including Sjogren's syndrome and radiotherapy. To treat dry mouth caused by Sjogren's syndrome, doctors prescribe pilocarpine. Pilocarpine is a tablet that stimulates the salivary glands. It may cause side effects, so you should consult your doctor before taking any medication. The most effective way to treat dry mouth is to take good care of your mouth. GERD medications. If you're taking GERD medications, chances are you've been dealing with bad breath related to your condition. This condition is caused by stomach acid backing up into the food pipe, and if it's bad enough, it can also cause embarrassing and unpleasant breath. The best way to get rid of stomach-related bad breath is to find the cause of your condition and treat it accordingly. There are several different causes of stomach-related bad breath. Prescription antacids. These medications block the secretion of stomach acid. These medications are best taken on an empty stomach, and half an hour or so before your first meal. PPIs that block the secretion of acid include omeprazole, lansoprazole, pantoprazole sodium, ribeprazole, esomeprazole, and Tecta. Another option is a dual delayed release capsule which releases the medication slowly in the stomach. The good news is that your dentist can detect GERD and treat it appropriately. Your dentist can also detect GERD symptoms, including bad breath. According to Chin He, assistant professor of medicine at Harvard Medical School in Boston and director of gastrointestinal health outcomes research at Massachusetts General Hospital, GERD symptoms are the result of food not moving out of the stomach properly. Regurgitation is another cause of bad breath in GERD patients. Foods that cause bad breath. If you've been wondering what causes bad breath, you're not alone. A low-carb diet can be one of the main culprits. Low-carb foods like onions, beans, and nuts can cause unpleasant breath due to anaerobic fermentation and the resulting acetone-like odor. Acidic drinks, too, can leave a bad breath after eating. Here are some foods to avoid. A high-protein diet can cause foul breath. The bacteria in the mouth convert proteins to ammonia, a gas-forming chemical that causes a foul odor. The amino acid content of dairy products makes them odorous, as does rotten eggs. Avoid dairy products, unless you are lactose intolerant. But don't totally avoid them. They contribute healthy fiber to the diet but may cause bad breath. Another food to avoid is garlic. Garlic contains sulfur compounds that stay in the mouth. Onions contain sulfur compounds that are absorbed into the bloodstream and expelled when we exhale. These compounds also contribute to halitosis. If you're unable to avoid them, try to eliminate them from your diet. Or, combine steps 1 and 2 to make a bad breath buster meal. Helicobacter pylori. Symptoms of stomach ulcers and bad breath from Helicobacter pylori may not be obvious. In these cases, it may be helpful to get a diagnosis and find out if you have this condition. In some cases, a simple stool antigen test will suffice. However, other tests may be necessary for a diagnosis. If the symptoms persist for months or even years, you should consult your doctor. Researchers have found that people who suffer from stomach ulcers have Helicobacter pylori bacteria in their mouths, even those who don't have stomach disease symptoms. Researchers from Fukuoka Dental College in Japan published this study in the Journal of Medical Microbiology. This bacterium is present in more than half of the world's population. In developed countries, the number of infected individuals is approximately 20%. In developing countries, this figure can be even higher. Inflammatory bowel disease can cause a bad breath due to Helicobacter pylori. Inflammatory bowel disease. Certain types of the bacteria can cause an ulcer in the stomach. Fortunately, treatment for this condition can eliminate the resulting bad breath. There are several treatments available. While you are waiting for an antibiotic to treat your disease, you can do some simple preventative measures to keep your mouth healthy. By reducing the level of acid in your mouth, you can eliminate the cause of your breath problems. We are so grateful that you stayed to the end.